All right, I'd like to call the meeting to order.
That's my role.
And Molly, will you please take roll?
Senator Mathis.
Here. Oh my, if this is the tone, I can't wait. All senators will be excused until they arrive. Minutes are approved unless there are objections. So let's go ahead, and today we're going to hear from Deanna Clingan-Fisher, the State Long-Term Care Ombudsman. Last year in Senate File 505, we provided resources to 2 new managed care ombudsman positions. We also tasked the Long-Term Care Ombudsman's Office to convene the Ombudsman's Alliance to study and recommend to us what a strong managed care ombudsman program should look like, and also to look at developing an overall consumer ombudsman alliance. Deanna is here today to report on the development of the new managed care ombudsman program to date and to describe the recommendations of the Ombudsman's Alliance. Deanna, please.
Thank you, and good afternoon to you all. As Senator Mathis stated, I'm Deanna Clingan-Fisher, the State Long-Term Care Ombudsman. We are within the Office of the State Long-Term Care Ombudsman and housed within the Iowa Department on Aging. So that is a mouthful. But I am here today as the facilitator and convener of the Health Consumer Ombudsman Alliance work group to share with you a little overview of what the outcomes and what that report does state, and then go a little bit into certainly answering questions that you might have regarding the Managed Care Ombudsman Program.
If I can intervene just for a second, this is live streamed, so people at home are able to see your slide deck, and they're also able to interact, so they may have some follow-up questions that we will send to you then, Deanna.
Tremendous.
Okay, thanks.
That's great. Thank you. So I'm here today, as I mentioned, to speak to the Health Consumer Ombudsman Alliance report. And I have a short presentation, and then can certainly answer it and open it up for questions if that's your preference. You should have 2 handouts that we brought with you today. One is the PowerPoint slide presentation I'll be speaking from regarding the Alliance report. Pardon me. And the second is the actual Alliance report, the full report. The Alliance Work Group and subsequent Alliance report are generated from Senate File 505. Senate File 505 actually tasked the Office of the State Long-Term Care Ombudsman with convening a group of multi-agency organizations and consumer advocates to carry out the various aspects of the bill. Specifically, the Office of the Long-Term Care Ombudsman shall collaborate with the Department on Aging, and this is a long list, so I like to read it so I don't forget anyone. The Office of the Substitute Decision Maker, the Department of Veterans Affairs, the Department of Human Services, the Department of Public Health, the Department of Inspections and Appeals, the Designated Protection and Advocacy Agency, or Disability Rights Iowa, in Iowa, Civil Rights Commission, the Senior Health Insurance Information Program, or SHIP, the Iowa Insurance Consumer Advocate, Iowa Legal Aid, and there were other consumer advocates and consumer assistance programs that were invited to attend and participate. We all came together to develop a proposal for the establishment of a Health Consumer Ombudsman Alliance. The proposal was developed to include an annual budget for each of the recommendations, and then it was to be submitted to the governor and to the General Assembly by December 15th. And it was submitted by December 14th, or on December 14th. The purpose of the Health Consumer Ombudsman Alliance was and is to provide a permanent coordinated system of independent consumer supports to ensure that consumers, including consumers that are covered by the Medicaid managed care program, obtain and maintain essential health care, are provided unbiased information and understanding of the coverage models that are available to them, and are assisted in resolving problems that might arise with their health care or with coverage issues, access, and their rights. The Office of the State Long-Term Care Ombudsman role in an effort in making this happen was to, one, facilitate the work group, invite the participants. So certainly we facilitated that work group, and that was creating, to help us create that independent support system. We researched best practices to see what is an effective means for the state of Iowa to follow. And then we placed projections for the budget based upon those different recommendations. We submitted the report on behalf of the task force work group to the General Assembly and to the governor. So our role was to facilitate the work group, to do the research, develop best practices, and then submit the report again on behalf of the work group. The report details 5 recommendations to carry out the mission of the proposed Health Consumer Ombudsman Alliance. And if I say HCO, or if you see HCO within your materials, that's Health Consumer Ombudsman. Not only did we come up with recommendations, but we also came up with a budget or a cost allocation plan for each one of the recommendations. The cost allocations, or the allocated costs with those recommendations, represent the initial year of funding only. And it was the recommendation of the work group to not implement or proceed with any of these recommendations if funding was not available. So what are those recommendations? First, to establish a health care ombudsman alliance. And I will go into each one of these a little bit more in depth in the next slides. To develop a Medicaid managed care information program. To implement a statewide single point of entry. To expand the Medicaid managed care ombudsman program. And to expand the current legal assistance program. So the first recommendation, establish a Health Consumer Ombudsman Alliance. Under the proposal, the alliance would identify gaps and discuss the healthcare needs of Iowans, make recommendations for systemic as well as for other changes that those members or that healthcare recipients in general have concerns over, and make appropriate consumer referrals. This would be accomplished in a tiered implementation approach. Knowing that we couldn't necessarily accomplish it all in the first year, let's start out with Medicaid managed care and move on to other healthcare arena issues. So that is our first recommendation as a work group, to establish a Health Consumer Ombudsman Alliance. Recommendation number 2 is to develop a Medicaid managed care information program. The Alliance work group, again, proposes the establishment of a program to assist Medicaid members in obtaining objective and unbiased information, counseling, and options for enrollment that they are not able to receive independently. This proposal was based off the Senior Health Insurance Information Program, or SHIP model, which currently extends to help educate, provide option enrollment information for Medicare beneficiaries. So the goal of this proposal, or this recommendation, would be to model the current SHIP model and extend it to Medicaid recipients and members, not just the Medicare members. So SHIP would handle the issues, help with enrollment, provide counseling and assistance for Medicare recipients, and the Medicaid Managed Care Information Program would assist individuals that are on Medicaid. Recommendation number 3 is to implement a statewide single point of entry. A single point of entry, or as many of us have heard this term over and over again, no wrong door approach, would help streamline and maximize efficiencies for the consumer. The consumer would not be then subjected to getting this phone number, and then trying to navigate themselves through that system. This would be a one-stop shop, so to speak, that would then tie them into the experts that can help address their concerns or issues. To maximize the current structures and to not duplicate services, we set up a structure so that where we tried to include this in a structure that already existed, such as lifelong links. So again, we tried to maximize and utilize resources that currently exist by reaching out to lifelong links and partnering with them to see if they would be able to take this on. So the recommendation is recommending that lifelong links actually serve as that single point of entry. Recommendation number 4 is to expand the managed care ombudsman program. This particular recommendation has received a lot of attention. And we have been asked a lot about this particular recommendation from the work group. And I think in order to explain this recommendation, a little bit of background is necessary. Under Senate File 505, the Office of the State Long-Term Care Ombudsman was given the task of creating a managed care ombudsman program. The managed care ombudsman program within our office would actually serve the people, the members that receive waivers, so the 7 HCBS or Home and Community-Based Services waivers, and those who are served through institutional care. That is approximately 57,000 of the Medicaid members. Our office was also, as Senator Mathis mentioned, given 2 full-time equivalent staff to help implement or carry out this program. Those individuals did start. They are on staff, and they did start in October. One is serving as the program manager. So she's helping us develop the program. This is a whole new program. We're developing policies and procedures so that we can be compliant with CMS requirements for approval. We are developing training and consumer pieces so that the individuals who need this information have access to it from our website and from us personally. And really looking at the data, what do we need to show success? What do we need to evaluate our progress and evaluate that so that we can be the best program we can be to serve the people we're here to serve? So that all goes into that program manager role. The other staff person is actually serving as the managed care ombudsman. And she's the one currently fielding the calls and addressing the concerns on behalf of those Medicaid members. Again, our current role is the 57,000. So those that are on the 7 waivers, home and community-based waivers, or are being served through institutional care. And that is approximately 57,000 of the total 560,000 Medicaid managed care population. So during our work group discussions, this issue came up. And there was concern expressed by members of the work group that who is serving as that independent advocate for the rest of the folks? For the difference between 560,000 and 57,000, who is their independent advocate? Because the Office of the State Long-Term Care Ombudsman, the role through the managed care program was to be and to serve as an independent voice and advocate for those members, or otherwise ombudsman. That's where the word comes from, that independent voice and advocate. So to address the goal of providing Iowans with an independent system for an ombudsman, for an advocate, and for their health needs in general, not just managed care, but health care issues in general, the work group explored two scenarios within this recommendation. And I'm hoping that this explanation helps make this recommendation make a little more sense. So there are actually 2 recommendations within this. There are 2 scenarios within this recommendation. One scenario, and I'm going to call it, for lack of a better word, comprehensive. It is a very comprehensive expansion scenario. Under that scenario, all 560,000 Medicaid managed care members would have an independent advocate. That is the number that some have been throwing out, which is 154 ombudsmen, and the support for that, those ombudsmen. And I will explain how we got to those numbers in just a few minutes. So the comprehensive expansion says that the current managed care ombudsman program would actually serve all 560,000 members. The scenario 2 is the limited. I'm going to call it limited scenario, meaning that this would still cover just the 57,000 Medicaid managed care members who receive services through one of the 7 waivers or through institutional care. So it would carry out the mandate and the intent of Senate File 505, but it would give a few more staff to do that. So we have expansion, we serve all 560,000, or limited, meaning we continue to serve the 57,000 folks that we've been tasked to serve, but we would have a few more staff added to our roles to be able to be an effective advocate for them and to help resolve their issues. Both scenarios, however, include a provision to actually add staff to the Office of the Ombudsman. Okay, that is not to be confused with the Office of the State Long-Term Care Ombudsman. In Iowa, we have 2 ombudsman offices. We have the Office of the Ombudsman, Christy Hirschman, I saw Andy, they are formerly known as the Citizen Aid Ombudsman. They are through the legislative branch. They serve to address the concerns of citizens when they have concerns against the state or local governments. So that is the Office of the Ombudsman. The Office of the State Long-Term Care Ombudsman is our office, and we serve as an advocate for those individuals who reside in long-term care. So nursing homes, residential care facilities, elder group homes, assisted living. So we serve as their advocate. So there are very different roles. So both scenarios also include a provision to add 2 staff to the Office of the Ombudsman. And that would be to help them answer and address some of the calls and concerns that they are receiving that they don't necessarily have the people power to address and handle right now. So in summary of the recommendation, there are 2 scenarios. One scenario is expansion. That's 154 ombudsmen, and that covers all 560,000 Medicaid managed care members. The other scenario is the limited scenario, and that keeps things exactly how they are. The managed care ombudsman program serves 57,000 folks under the waivers and institutional care, but we add a few more staff to help meet their needs. Because, the conversation was, it's kind of a low number of staff to really meet the entire needs of that population. And then both scenarios include adding 2 additional staff to the Office of the Ombudsman so that they can also have assistance in meeting the needs of Iowans who reached out to their office as well. So you may be asking, and a lot of people have, how did we come up with that 154? And how did we come up with 16? Because in the limited model, the recommendation was 16 ombudsmen. How did we come up with that number? Well, as part of the work group alliance, the Alliance Work Group, our office was given the task of doing that research, figuring out how many people, you've got a new program. How do we figure out, when we've not even done it before, how many people we need? So instead of just guessing, we reached out to other states who have done this before. And we pulled up their data. We asked for their best practices, staffing patterns, and ratios. And what we received back, and this was a conservative estimate, because some people are much lower, but what we received back from the other states is that a best practice ratio is moving from 1 ombudsman for every 3,500 Medicaid managed care members. Okay, that's best practices from other states who are already doing this were 1 ombudsman for every 3,500 Medicaid managed care members. When you do that calculation, you're going to come up with 154 ombudsmen for 560,000 people, and you're going to come up with 16 ombudsmen. Or know that this is the right amount? No. We have no way of knowing. We are utilizing other states' best practices to create something in Iowa that we've not done before. So the reality may be somewhere in the middle. It may be somewhere in the middle. But at least this starts the conversation, and it starts the conversation from a place where other states have already been. So that's the recommendation number 4 that has caused a lot of discussion and questions. Recommendation number 5 is the last recommendation of the work group alliance, or the alliance work group, and that is to expand the current legal assistance network. So the work group foresees that there will be an increased need for legal advocacy for Iowa's Medicaid members who are served by a managed care organization. The work group recommends expanding the current legal assistance network so those who are already doing these types of appeal cases, but with very few staff, and that is Iowa Legal Aid and Disability Rights Iowa, to include or expand the legal assistance network so they can actually meet the needs of these Medicaid members who may need legal assistance, support, and guidance. And what we're talking about here is through an appeals process, through a grievance process, and through a state fair hearings process. And it would be for those members who are facing reduction in services or a termination of services. So the legal assistance would be for those who are facing reduction in services or termination of services. I'm not sure if all of you are aware, but within the managed care organization contracts, members are granted the right to file a grievance, and that's to express dissatisfaction with a matter. They are also granted the legal right to file an appeal or request a review of an action or a decision by the managed care organization, especially if the member would like that decision reconsidered. And there are timelines associated with that. Members who exhaust the internal appeals process through the managed care organization then have the right, the legal right, to file for a state fair hearing. So at any point in this process, you may need legal representation to assist. Now, ideally, you would have the managed care ombudsman program available to actually seek informal resolution so that we wouldn't need to take all of these issues to their full course of legal representation. And then the state fair hearing would be a last resort. But we know for some it will be needed, and for some need to be able to refer to Iowa Legal Aid or to Disability Rights Iowa or other persons that are in our referral network to ensure that that member receives legal assistance as they need. So we are currently, and part of our program manager's role is developing that referral network so that when a member does need assistance with whatever the issue is, they can reach, we have an appropriate referral network that will meet their needs and get them the assistance that they are entitled to. So that is the 5th recommendation. And that concludes my remarks on the actual Alliance report. If you have questions on that, I'd be happy to entertain them.
Thank you. I think Senator Reagan and Senator Taylor have questions.
Thank you, Deanna. Did you talk about how many calls you're getting a week?
I have not, but I can.
Can you
And
just give us a little kind
course.
of rough feeling of where you're at?
Yes. So from December 1st, we have received 464 calls. I would say the last 2 weeks have been very busy for us. And I have those numbers. So the week of January 11th, we received 295 calls. And the week of January 18th, we received 141 calls. Generally, these are calls. We certainly, when we talk to folks, we say, have you talked to IME Member Services? Iowa Medicaid Enterprise Member Services. That's their first stop for many of these issues because managed care hasn't begun yet. So there's nothing for us to assist them with the managed care organization. So we certainly refer them to IME Member Services if at all possible. Some don't have the ability to stay on the phone or have decided that they would prefer to leave their information with us. So then we forward that information to IME Member Services and ask them to reach out and respond to those members.
When managed care, if managed care starts, will you have access to their records?
Currently, we do not have access to the Medicaid system. We are in conversations, and I do have a meeting set with some folks within DHS tomorrow to have that discussion. What are the data points that would be helpful for us to have access to so we can actually meet that member's need rather than giving them another number to phone? Some of the questions that are coming in, we could easily address for these folks if we had some of that information. Simple information like, what Medicaid program are you on? Are you one of the 57,000 that we actually are here to serve, or do we need to refer you somewhere else?
And then my last question is, if you're going to advocate for the 57,000, who's going to advocate for the others if we don't?
That is a very good question, and I believe that is why the Alliance Work Group came up with the proposal that those other Medicaid managed care members need an advocate and an independent voice as well. You're welcome.
Senator Taylor?
Thank you. Thank you, Deanna, for being here. My question, I guess, I do math a little bit different than you do, but I came up with 160 that you would need
Yes.
for 560.
You are correct.
1,000 people.
But
I'm assuming that's not 24/7.
that would be correct.
That would be, because a lot of people I know call me personally, and they don't seem to know that, that I sleep at night and things like that. And once in a while, anyway.
You try.
And I have a feeling that you're going to have that same issue because everybody doesn't sleep on a regular schedule. Are there any plans to help those people in that situation, or have you given any thought to that?
That's a very good question. So as to the 24/7 access, we have not specifically thought about that, but we are certainly willing to look into that and think about it. And I'll have someone write that down so that we can have that conversation. As to your 160 comment, because I did my math last night too to prepare for this, on the Alliance report, the 160 includes not only the ombudsman, but also support staff. Because if you add 154 ombudsmen, you better well have some support staff, a fiscal person to assist them in paying bills or typing letters or returning some phone calls. So you are correct. The 154 is not the 1 to 3,500, it's the 160. But the 160 includes more than just ombudsmen. Yeah.
And my next question would be, if this, in fact, managed care starts March 1st, which I highly doubt, and I sure hope it doesn't happen, how could you possibly hire 160 or 150 ombudsmen in time to really help any of these people? I mean, how long would it take you to get 160 people hired?
A very good question, and one I hadn't really thought about. But I have become very good at hiring within the state system. And so the minute I know that I can certainly start writing job descriptions and have position description questionnaires ready to go so that if it were funded, we would be able to, submit those instantaneously and then perhaps hire within a month or so. But then, of course, you have to build in time for training and education so that these folks know how to adequately address and answer some of these questions.
So what I'm hearing is not only DHS is not ready to implement this, you're a long ways from being ready to implement this as well?
Another good question. I wouldn't necessarily state that we're a long ways from being ready to implement this. I believe that with the current staff we have, we can meet the needs of the people that call us. Can we get as in-depth or be as comprehensive with them with one ombudsman and one program manager? Probably not. But that doesn't mean that we couldn't still perform our functions as a managed care ombudsman.
Thank you.
You're welcome.
Senator Garrett.
Thank you, Madam Chairman, and thank you for being here.
You're welcome.
I have several questions and thoughts as I listen to your presentation. You mentioned Medicare ombudsman. How many of those do we have in Iowa?
Medicare ombudsman, we do not have any Medicare ombudsman in Iowa. That's a federal program. We do have SHIP, Senior Health Insurance Information Program, which serves as a Medicare assistant. You know, they assist Medicare beneficiaries. But as to Medicare ombudsman, we do not have any that are state employees. That is a federal position.
Well, okay, so how many does the federal government have in Iowa then?
They have, I don't know how many they have in Iowa. My impression when I've talked with CMS and HHS is that they are individuals that are regionally based and they respond as issues arise.
So they might not have any physically in Iowa, they might be in Kansas City?
That is
maybe?
correct.
Okay, all right. What about, you mentioned we're kind of basing this on other states' experiences. Do other states have ombudsmen to this level? Do you know the level that you're talking about as a comprehensive
Right.
level?
That's a very interesting and intriguing question from the perspective of the rules slightly changed a few years ago when managed care ombudsmen have always been encouraged, but not necessarily was it part of the deal to receive a waiver to proceed to move from fee-for-service to a traditional Medicaid managed care program. Within recent years, CMS has started providing guidance to states that if you choose to move down that path from fee-for-service to managed care or capitation system, that the guidance is you do need to have a managed care program. I will be one of the first states after Kansas that has gone through this process after that new guidance.
Well, are you saying that other states don't have this ratio of ombudsman that you call the comprehensive level? Well, I misunderstood. I thought you said we were arriving at that figure based on experiences in other states.
Right.
So other states haven't done this.
So other states have ombudsmen. So I was making a distinction between what occurred prior to guidance from CMS and just recent policy and discussion from CMS. But other states do have multiple ombudsmen. I do not know what other states' Medicaid managed care population is to say if they meet the 1 to 3,500 staffing ratio. I can certainly find that out, but as Senator Yoakum mentions, other states like Wisconsin do have many managed care ombudsmen that are available to reach out to meet that need.
Okay, well,
I don't know that they reach the one.
I misunderstood. I thought we were recommending this level because of what other states have done. I guess that isn't the case.
So what the Alliance Work Group recommended based on research is when other states are working or implementing a managed care ombudsman program, their recommendations for best staffing ratio is 1 to 3,500. Do the other states meet that ratio? I do not know. I do not know.
Okay, so I'm kind of unclear on who is it that's making the recommendation? It's some folks in some other states that are involved, or is it the state officials that are running these programs?
It's the individuals.
Advocates in other states are saying, this is what we think you ought to have. Is that accurate? Okay.
That is how I read it as well. But certainly we are developing some information on that, and I would be happy to share that with you.
Okay. Now, It seems to me, I recall a few years ago having some contact with some ladies that were kind of volunteer advocates. And I'm assuming that program is still going on. I think there were some changes being made at the time.
You are correct.
Would people like that have any role in what we're talking about here?
I think that's a very good question and a good process that we all, as in Iowa, need to go through. The program you're talking about is the Resident Advocate Committee program, which transitioned to the Volunteer Ombudsman program. And we do recruit and train volunteers to go into long-term care facilities and serve as the eyes and ears for our office. They are an ombudsman, a volunteer ombudsman. The question has arisen, and I know Kansas is following this lead, where they are recruiting and training volunteers to do this type of work as well. And I don't know that anyone would be opposed to looking at a volunteer model. So I think that's a good discussion point that we could all talk about.
Okay, well, great. I hope you will, because with our budget issues, that might be a way to kill two birds with one stone, so to speak.
Sure, and of course, I always mention, because we run a volunteer program, volunteer programs still cost money, even though you utilize volunteers.
Yeah, well, of course, but not near as much.
Maybe not as much.
Okay. And then, what role does the insurance department have in all this? Do they have any role at all?
That is a question that came up at our Alliance work group. Certainly the insurance division, the consumer advocate, and senior health insurance information coordinator were on our Alliance work group. The question arose, and we didn't necessarily have time before the report was due to reach out to the commissioner, the insurance commissioner, to see if he would be interested in taking on the second recommendation, but it certainly would make sense that the insurance division take on the second recommendation and create that ship-like model for people on Medicaid.
Oh, we don't want to be duplicating
Exactly.
services, yeah.
That's exactly right.
All right, well, thank you very much.
welcome.
I appreciate your answers.
Thank you.
Deanna, was there any actuarial modeling, or did you go any deeper than, so again, the ratio, 154 to 560,000 and 16 to 57 are based on the same evidence of a complexity of the case. You see what I mean?
That is true.
So if it was children and families, which doesn't use as much of the budget as, say, the 57,000 on waivers, right? So the complexity of the case, was there any discussion around fewer for children and families, fewer or less representation because of maybe the case wouldn't be as complex compared to maybe a waiver case?
Within the Alliance work group, we did not have that discussion, but I think it's worthy of discussion.
Okay.
I do. That's a great idea.
And then on page 23 of your larger report, you have Office of Ombudsman's role in Medicaid managed care, and you have a typical complaint progression. I know you talked through that a little bit, but we have a diversion program, in the state of Iowa, where we make these decisions where a case is going to go in behavioral health or children's mental health. Do you have a pretty firm idea of how this is going to look once somebody calls Lifelong Links, whether they call your office, how that protocol is going to look, and what's the decision making to divert that case off into other areas?
We are currently working on that referral network process. We have had meetings set up throughout the month of January and into the month of February to answer that exact question. We're meeting with the agencies that we feel that we would need to make referrals to figure out what is an appropriate referral to your agency. Lifelong Links, Disability Rights Iowa, Iowa Legal Aid, Senior Health Insurance Information Program, the Insurance Division, just to name a few. We're certainly meeting with DHS and IME on when is it an appropriate opportunity for us to make a referral to you, because what we don't want to do is cause further confusion for these folks that are calling us, because they are reaching out needing assistance and support. and we don't want to create more confusion for them. Have we thought it all through? We're building it into our policies so that when we receive that call, we know, okay, we're not going to make a referral here because that's not an issue that they will take on or address. So we're still in that process of determining it. And until we have it finalized, we're reaching out to the partners we already have through the Long-Term Care Ombudsman Program, through the Aging Network, and saying, is this something that you can take on behalf of this member? We're meeting with some of the disability groups in particular, so that we understand what is that network, because we really know the aging network, but the education that we really need is on determining and figuring out the disability network. So we're reaching out to those partners as well so they can educate us.
And one final question for me before we get to Senator Bolcom and Senator Dotzler. So the job description for this, is it helpful to hire someone with a legal background? What kind of person are you going to be looking for in an ombudsman? Will they have to have different backgrounds if they're going to be helping someone, say, in the waiver population versus children and family? So how have you thought that through? And it really is volunteer help. Really, I mean, we're talking about pretty complex cases by the time it's going to get to your desk. So talk a little bit about that.
Sure. So when we originally hired the 2 positions that we had, we knew that we needed someone to actually develop and manage the program. And so we built those skill sets into the position description questionnaire. When we came to hiring and filling the position for the managed care ombudsman, we looked for a knowledge base in Medicaid in general. I don't know that we necessarily looked to say, are they a lawyer? Are they a social worker? Are they a teacher? We just really looked at what is the knowledge base that this individual comes into our office that can help us help the people we're here to serve. And so that's more the context that we looked at. We are currently discussing with the Department of Administrative Services creating a new classification called Managed Care Ombudsman. And if we do that, then we would be able to build in those types of criteria to look at what is their education level, what is their knowledge level coming into the position. And I really like your idea of creating different positions depending on the number of staff for disabilities, for each of the waivers, for aging, because each of those are unique programs in and of themselves.
Much. Senator Bolcom.
Thank you, Madam Chair. Deanna, thanks again for your work on this. I think you did a thorough job, and I think your recommendations all make a lot of sense. I think the challenge to us is I think in the short run figuring out how to finance them. Senator Garrett, on the issue of Medicare, Medicare's been around for 50 years. People that get ready to go on Medicare have plenty of time to think about their choices around whether they need a supplemental insurance policy. And of course, when they're on Medicare, if they have a challenge, they can go to their Social Security office or their member of Congress to get help with Medicare. I think the governor's decision to turn Medicaid on its head overnight, essentially, and the more than 500,000 Iowans that are on it requires that people get immediate answers about really dire questions about what insurance company is best for me and my family. So it's pretty clear that we haven't planned very well for this. I don't know, there's probably going to be at least 560,000 phone calls made by Iowans trying to figure out what should I do, what is best for me, or probably more when you think about if you're going to call through to your providers to see if they've signed up with the MCO you've been auto-enrolled in, trying to figure out if you have more than one provider, if those providers have signed up with the MCO you've been auto-enrolled in. If they've not, what MCOs have they signed up with? I mean, it's complicated, I think, for vulnerable people to try and figure out. And it's really, people are scrambling, and we've got a very limited ability to answer the calls and answer them with good information. So it's pretty clear we need more ombuds people. The resident advocates are really people that oversee or pay attention to the care that people get in the facilities. It's a completely different function than advising people on their insurance. I like the recommendation around establishing some sort of SHIP advisory effort around helping people manage through the decisions about those MCOs.
Great.
But to organize even volunteers to give advice to Medicaid recipients, that's like a year away. I mean, that's an appropriation to create a brand new program and then recruit volunteers, train volunteers. I mean, so I know the governor said last week or the week before when your report came out that the proposal to add all these ombudsmen was overkill. I'd be interested in his idea on what wouldn't be overkill, but that would put more people working on this. I think it's going to be a big struggle for us as we look at the Health and Human Service appropriation process to find very much money at all to establish, certainly not 150 new positions to do this, but even, I mean, we struggled to add 2 new positions this last session, as you know, in 2015. So the time frame for this is more evidence about really the unrealistic time frame that this proposal was put forward by the governor, and it's pretty clear that CMS needs to delay this to give us more time to put infrastructure in place to help these vulnerable Iowans make the best decision going forward. Thank you, Madam Chair.
Thank you, Senator Bolkum. Senator Dotzler.
Thank you, Madam Chair. Diana, thank you for your work on behalf of Iowans. I want to go back to Senator Taylor's comment about being prepared just with the amount of people that you have. I at one time served as president of my local union, which was a pretty good sized union up in Waterloo. As president, my job was really to deal with our HMO, our health maintenance organization back then, and our membership's calls. And I served as president, and I spent my whole day, every day, dealing with phone calls from less than 6,000 people through this maintenance organization that was relatively, it'd been around for a while, but our union was one of the first in the state that switched to try to keep healthcare costs in line, which we agreed with and thought it was a good idea. And I found out that company, in my opinion, denied cases just to deny them. And when I'd call them up and point out that this contractual agreement, you'd look at certain lines and they go, oh yeah, we should have paid that. And I spent time after time on the same type of thing over and over again and asked them, why are you repeatedly doing this? And talking with members, you know, at our local meetings, we find out with people who are retirees that said, well, they said I owe it, and they just went ahead and paid what they were supposed to pay. A lot of the calls weren't that case. They set up reasonable customary charges that were different than all the doctors in our community were used to getting. So I suspect that with our MCOs, who are a for-profit company, they're going to do kind of the same type of things. And to think that 560-some thousand Iowans are going to have few enough calls that you're going to be prepared to handle and do a reasonable job. I understand your optimism, but holy mackerel, come on. So we, in my view, and you know, you got to have some more people to work on this, and I don't know if the right answer is more than 100, but I got to tell you, you're going to be so overswamped that there are people out there that are going to have decisions that they're going to have nowhere to go, and they're going to have to abide by the decisions of a company who's telling them this is it and too bad. And so I am deeply concerned about the turmoil, especially when you switch over and start up something new. It isn't like what Senator Bolkum was talking about, with Medicare that's been long established, and people have kind of worked through those problems. And not unlike your office, where you worked through a lot of issues that have been out there for a while, on the state mature program, you still get them. So to think that we're going to jump into this in a relatively short period of time and get it resolved by just your staff until you can get some help, and do you got to go through the same hiring process as all state employees?
Yes.
Holy mackerel, you're in trouble with that too then. So I see this as pitfalls full of problems, and it's really the system and the way this, if we implement it when we're supposed to, the deck is going to be stacked against Iowans who desperately need these services. They're going to have nowhere to go. You're going to work as hard as you possibly can to take care of their problems and probably put them on a priority basis of the most severe ones first. At least I'd hope
Yes,
you would.
we have.
And it's still going to be unworkable and put Iowans in real risk of taking care of some of the most vulnerable people in the state. And I am deeply concerned, and I can't express deep enough the concerns I have, because I have lived something on a mini scale. 6,000 people. And I was working every morning from day to night till I thought, what the heck did I ever want to do this?
Sign on for.
I mean, I thought I was going to, have it easy. And it was a living hell for me. And I felt so sorry for the people that were out there that actually paid for stuff that they didn't have to pay for. So, I don't know. This, man. Thank you, Madam Chairman.
Thank you, Senator Johnson. We have about 2 minutes left of the meeting, but thank you. And Senator Yoakum, did you have a question?
I do. So let me kind of ask Senator Allen's question too. What's your current caseload outside of if we would ever move into managed care for the Medicaid population? What's your caseload right now in terms of long-term care?
So for
And
long.
the complexity of those issues.
What we learned when we talked with other states about the managed care ombudsman program is that those cases are 3 times as complicated as a long-term care ombudsman type case.
Okay.
We receive, and you should be getting the annual report for the Office of the State Long-Term Care Ombudsman in 2 days or so. But we received a little over 1,106 complaints last year for long-term care related issues.
Okay, thank you. So the other thing I recall from reading through Can-Care in Wisconsin and other states that have put together some kind of ombudsman's program, that 70% of the complaints and calls that are coming in were the Medicaid population that was outside of their traditional populations that you would have served anyway, like the waivers, like the long-term care. That 70% of the problems and complaints came from outside that population. So we go back to Senator Mathis's question on that children may not need as much service or may not be as complicated, and maybe not.
Right.
But that 70% of the complaints in other states came from the less complicated populations to
Issues.
begin with.
That's good information.
Okay, great. Okay, thank you. That's
Thank you. Thank you.
Senator Allen, did you have, so Senator Yoakum, all right. Is there anyone else with a question? All right, well, with that, thank you so much, Deanna.
Thank you. I appreciate your
presenting to
time.
us today. Informative. The work group must have been, your committee must have been very busy.
We were.
This is very comprehensive. You did a great job, so
Thank
thank you
you.
very much. Future meetings next week, because of the presidential caucuses, we most likely will only have one meeting, and we'll run bills and have some time for the Democrats to caucus. I think maybe the Republicans will want to do so too. I'll talk to Senator Johnson about that. Thanks, everybody, and Senator Yoakum moves that we adjourn.